Ear balance disorder, how it happens, an overview. Vestibulo-cochlear complex. Medial 1/3 of the ear canal, middle ear as well as the inner ear, are situated in temporal bone, shown here in green color. The area mentioned is marked with red border. Middle ear and the inner ear structures are illustrated here. They are positioned inside petrous part of temporal bone. This is the vestibulo-cochlear complex, comprising of cochlea and semicircular canals. This is shown in 3D. The vestibulo-cochlear nerve and the small bones, malleus, incus and stapes are colored yellow in the illustration. This is the cochlea which is displayed with red border. Semicircular canals are displayed with red border. This is the bony labyrinth in which the membranous labyrinth consisting of cochlea and semicircular canals are positioned. This is a magnified view of cochlea, which is displayed with red border. The diagrammatic representation of cochlea. This is a magnified view of semicircular canals are displayed with red border. The three semicircular canals detect the rotational movements of the head. The cell bodies of the vestibular nerve are located in the vestibular ganglion, which is housed in the outer part of the internal acoustic meatus. It measures from 12 to 15 millimeters, and its arch is directed horizontally backward and laterally, thus each semicircular canal stands at right angles to the other two. The inner diameter measurements of the anterior semicircular canal, lateral semicircular canal, and posterior semicircular canal are 1.01, 1.35, and 1.24 millimeters, respectively. The membranous labyrinth is the bony labyrinth. How the balancing system works. The semicircular rings in the vestibular system are oriented perpendicular to each other. The ends of these tubes open to the utricle. On the other side of head the semicircular canals are positioned as mirror images, so that all the 6 canals from both sides are positioned at different planes and directions. When head is rotated, there will be fluid movement in these canals. The flow rate, speed and direction of flow will be different for each ring, since all the rings are in different planes and directions. Brain, by calculating the data from these inputs, will arrive at a decision of the direction of head movement. Brain is always cross-checking these with the visual input. Usually it will be matching, and there is no problem. If there is no match, brain decides that what you see is wrong, and applies a correction to the visual input. This results in the feeling of rotation of the surroundings in various directions and planes. This happens when a child rotates on the vertical axis, and abruptly stops. Then the child can see that the earth is rotating. This happens because brain applies a correction according to the data input. This data is generated by the sensor cells in the otolithic membrane, positioned adjacent to each semicircular canal. We shall discuss it briefly. The cupula is positioned in the dilated part, ampulla, of each semicircular canal. This is the position of the cupula while standing motionless as the person does. This is the movement of the cupula while rotating as the person does. This happens in every cupula, 6 of them, in varying degrees. The signals to the brain are generated by the hair cells inside the otolithic membrane, on which is the cupula positioned. This is a small portion of otolithic membrane. What you see is the very highly magnified neural side of the membrane. The blue-colored cells are the sensors, which sends data of head movement to the brain. These are kept wedged among the thickly packed cells. There are almost 15,000 such sensor cells in each otolithic membrane. Each hair cell is connected to the vestibular center of brain by neurons. Above the layer of thickly packed cells is a layer of transparent jelly to which juts the cilia of the sensor cells. When cupula above this membrane moves, there will be a slight movement of the cilia of sensor cells. This leads to generation of impulses by the sensor cells, which will pass on to brain as action potentials. To elicit data properly from all the sensor cells, the jelly layer has to be under pressure. For this purpose, there is a layer of ultramicroscopic calcium carbonate crystals, dispersed all over the membrane. Atoconia of humans are very small, ranging in size from roughly 3 to 30 microns, averaging about 10 microns. The electron microscopic images in the inset. The electron microscopic image, further magnified, is in the inset. When these atolls get loosened by head trauma or microwave radiation from mobile phone or mobile towers, there is a chance that it may enter any of the semicircular canals. When it happens, there will be a slight resistance for the flow of endolymph in that particular semicircular canal. So that slight fluid movement will continue in that particular ring. But there will not be fluid flow in other 5 canals. The fact is that it is impossible to move the head with resultant fluid movement in only one semicircular canal. Because of this abnormal situation, brain gets confused also. This is the reason for nausea, heaviness of head, vomiting, etc. experienced by the patient. But brain still considers that the head is being rotated to that position. The patient experiences that head is being forcefully rotated to that impossible position. This is the reason for the traumatic experience of the patient. As there will be no movement felt in the visual input, brain rotates the visual input to that impossible position to synchronize with the input from the particular semicircular canal. This experience is impossible to perceive by persons including doctors, the reason for the confusion in the management of BPPV. Many people with BPPV feel that there is whistling or other sounds in the ear. Now we shall look into the reason for the sound in BPPV. What is displayed here are cochlea, semicircular canals and their inversion up to brain. The vestibulocochlear nerve, 8th cranial nerve, is a sensory nerve. It is made up of 2 nerves, the cochlear, which transmits sound, and the vestibular, which transmits signals from the movement of head. It is an intracranial nerve, which runs from the sensory receptors in the internal ear, to the brainstem nuclei, and finally to the auditory areas. Size of the nerve. Vertical diameter 1.4 mm, horizontal diameter 1.0 mm. This is the diagrammatic representation of vestibular and cochlear nerves, which join to form vestibulocochlear nerve. Inside the brain, vestibulocochlear nerve, again bifurcate to vestibular and cochlear nerves, and terminate at vestibular and auditory centers. This is important to understand why most ear balance disorder patients experience some abnormal sounds. The nerve fibers from vestibular and cochlear nerves intermingle in the vestibulocochlear portion of the nerve shown here. Normally, this arrangement works beautifully. When there is balance disorder, there will be defective signals from the vestibular section. These abnormal signals interact with the neurons from the cochlear nerve, causing some error in those fibers. When these error signals reach the auditory cortex of the brain, the auditory centers interpret the error signals as sound. This results in the patient hearing whistling or hissing, etc., which actually does not exist. This situation is observed in around 60% of BPPV patients. In such cases, these sounds will disappear within a few days after correction of BPPV. I have tried to explain this as simple as possible, but I know that still there will be doubts on the subject. Don't hesitate to contact to clarify any doubts or manage any problems.